My cancer was metastatic when it was first found, so we've just had different types of trials of different chemotherapies, and I did have a very serious cancer-caused bowel obstruction this summer, so I was hospitalized in different places for 23 days. So been through quite a bit, appreciated the work of palliative care quite a bit for helping with the different symptom managements. But in December, both from Mayo Clinic, who I worked with some specialists for this rare appendix cancer, and my local oncologist, Dr. Basu, it was clear that the chemos, their last-ditch efforts weren't working. So I was actually thrilled, to tell you the truth, because it takes its toll on a person. And when you know you're only going to have so much time, you have to weigh, well, what shape do you want to be in for it? So it's always a trade-off, but I was ready for hospice. I had been ready for hospice for a long time, actually, but this was the time. Now they have things like massage, which is new. They didn't do that when I was a hospice social worker. So I think that's great. They're trying to get more of the integrative approaches, which work very well for me. At this juncture, I have the nurse coming in. We're trying to get symptom management, particularly for pain. And this is a kind of, ever-changing story about the cancer and how it's growing and which organs it's impacting. So that's great to have a nurse to help with the care management of the pain. And social worker and chaplain came in for an initial visit, and they're going to help me put together something to gather all my good, caring circle of friends, people, because it's hard on everyone when you get the news. It's certainly hard on me, but certainly hard on everybody that loves me. And so I thought, well, let's do this as a team. We've been through everything else so far as a team. Learn more how to accompany someone in a way that seems calming and comfortable. We can't really fix this. So we have to learn how to be with it. So that's what I'm hoping for. I'm a person that cares so much for people that I can't really use my energy to worry too much about how other people are handling this. But it is hard because I've been in the other shoes when my sister Mary was dying and was on hospice. So, I'm just trying to think of how can we use the resources of the hospice team itself, so that the social worker is going to try to help me work on some kind of a gathering. Hospice, you could have like in large, bold letters or something, but it's just one day I wasn't on it and one day I'm on it. I have been on this journey a long time. So I have to psychologically not put too much power in the world, but simply see it as another tool to help me live as best as possible at this stage of my life. So, and to keep as much as possible the reins on my own life. I'm a very independent person. Having lived for 23 days in the hospital with an NG tube in and a feeding tube, I'm certainly not interested in that scenario anymore. More people know about hospice than when I was a hospice social worker back in the late 1999s, but a lot of people still don't. And they don't understand it's not just for the 3 days before you die. It can help you for quite a period of time, and it can help your family. So now I'm just writing more of the family stories, or recording more the stories behind things, and the stories of my daughters and my story, for whoever wants to know. Well, if someone was in my shoes, I hope you will gather people around yourself and use hospice and other resources, palliative care, so that you don't feel alone, because you don't want to be alone at such a challenging time. You want to feel well supported, and you have to be gentle with yourself. This isn't easy, and it can certainly be scary. So, but I feel, well, it will unfold the way it unfolds. I will be surrounded by love and divine grace. So, I believe every day is a gift, and every day there's opportunities to give and receive, and I hope I will do that to my last breath. So don't be afraid. Reach out for help. Let people love you and be open to receiving. It's not easy, but it's the gift you can give them, because after you're gone, they'll find comfort to know that they could help you live the life you were trying to live. So it's a gift. I learned that along the way. It's a gift to be willing to receive care and help with snow shoveling or groceries or meals or garbage or errands. And your life isn't over till it's over. So you can still grow in relationships with people. It's an adventure. I'll see how it unfolds, but it's an adventure. And it's not over till it's over, so just keep having hope.